Welcome to the Station 1 evaluation. In this section, we will look at the sports PPE physical exam and look specifically at the Station 1 section, which includes the appearance, EENT, and lymph node assessment. So an overview of this station, we'll look at the UIL form and the different components that we'll be responsible for doing on this station. So if we look on this right-hand side here in the red box, we'll see the different components that we are responsible for at Station 1. The first thing we need to look at is the appearance, general appearance of the student athlete. The second thing we need to look at is the eyes, ears, nose, and throat, also called EENT exam. And the last thing are the lymph nodes. Let's start by looking at the appearance. So when we look at the appearance, the minute that the student athlete comes into our station, we're starting with our eyes and we're looking the student athlete up and down. Do they walk with a limp? Do they have a discoloration to their skin? Does one of their eyes not track when you look at them in the eye? You have to use your eyes and your assessment generally at the minute they walk into your section. And so you're going to observe the overall health status. Are they obese? Are they skinny? Do they have any signs of distress, any malnutrition? Do they look dehydrated? Do they have chapped lips? You're going to look for these signs. You're also kind of just at a glance looking for any of the indicators for Marfan syndrome. Now, we will have a specific section for Marfan's later on, but here you're just kind of getting an overall global assessment of your patient. You're also in this section going to be responsible for reviewing the vital signs that have been done. And you'll want to look over these, look at their blood pressure, their heart rate, and any abnormalities that you notice there. You'll also want to review some of their relevant medical history for the station. So in this station, again, we'll be covering the appearance, EENT, and lymph nodes. So you'll want to kind of assess, do they have any medical problems? Are they on any medications? Have they had any surgeries? And do they have any problems with their EENT or lymph nodes areas? Now let's look at a quick demonstration of how this station would run.
Welcome to Station 1, which includes general appearance, ENT exam, and lymph node evaluation. In this demonstration, we'll review how to assess the general appearance of a student athlete. This is an essential part of the sports pre-participation exam. Let's get started with the general appearance. As you approach the patient, you're going to take note of their overall health and well-being. Look for signs of distress, malnutrition, or dehydration. Observe the patient's posture, body movements, and any visible abnormalities. Here I'm looking for any signs of physical discomfort, asymmetry in body posture, and overall demeanor. I'm also checking for visible skin conditions such as rashes or jaundice. Next, we need to observe for signs of Marfan Syndrome, which can be indicated by long limbs or chest deformities. Eric's limbs appear to be proportionate. Can you stick your arms out straight to the side like this? Okay. Excellent. There are no immediate signs of Marfan syndrome. A more detailed assessment of Marfan's will be done in Station 3. Lastly, review the pre-recorded vital signs, ensuring they fall within the normal range for the patient's age. Eric's blood pressure and heart rate are within normal limits. This concludes the general appearance assessment. Remember, this initial evaluation sets the stage for a thorough and efficient exam. Always communicate your findings clearly and concisely. Thank you for watching this demonstration. In the next section, we'll cover the detailed eye examination. Stay tuned.
All right, the next portion of this station is the eye exam. The eye exam is really crucial because if you can't see, you can't play sports very well. So let's look at our first, the visual acuity. So we won't do this visual acuity at our station, but if we notice that the student athlete comes to the station without having a documented visual acuity, or they have an abnormal visual acuity, then we can assess that. Remember, normal visual acuity is 20/20, but anything less than 20/40 is considered acceptable for passing or for clearing the sports PPE. On our end, what we want to look at is the pupil exam. So with the pupil exam, we want to look at, are the pupils equal on both sides? We have two eyes, so is the right eye pupil equal to the left eye pupil? And we want to use our light. We can either use a pin light or we can use our otoscope. We want to shine the light in one eye, looking at that eye for pupillary constriction. Then we want to shine it in the other eye, looking for that eye's pupillary constriction. And then we want to do it again, only this time when we shine the light in the right eye, we're actually going to look at the left eye and vice versa. So this will assess to make sure that our pupils are reacting equally on both sides. Next, we want to look at the extraocular movements. This is what I like to term the airline stewardess. So you want to kind of show this a big H pattern. If you've ever been to an eye doctor before, you probably know what I'm talking about. So you'll want to take your index finger or a pen or your pen light, and you want to draw a nice big H. You don't want to get too close or too far away from the patient. You really want to take their eyes all the way to the periphery without moving their head. The last thing we want to do on this, and usually I kind of start with this from the very beginning of the exam, is I'm looking at the external eye. I'm looking for any swelling of the lids, any tearing, any redness of the conjunctiva, whether or not they use contacts, and maybe educate a little bit on good hygiene for contacts. Looking for lid drooping, anything like that, any abnormalities, and I'm going to discuss them with my student athlete. So let's go take a look at a demonstration of the eye exam.
Welcome back to the ENT station. In this demonstration, we will review how to perform a detailed eye examination on a student athlete. This is an essential part of the sports pre-participation physical exam. Let's start with reviewing Eric's visual acuity results. They're documented on this UIL form. Eric has 20/30 vision in both eyes with corrective lenses. An athlete can usually be cleared with a 20/40 vision or better. All right, next I'm going to perform an external eye examination. I'm going to inspect, and I'm looking for any redness, any lid deformities, or any other abnormalities. Can you look up for me? Great. Excellent. Now we'll check the extraocular movements in the 6 cardinal directions: up, down, left, right, and diagonals. I will ask the athlete to follow my finger with their eyes without moving their head. I am looking to be sure the eyes track in unison and that there's no lagging. All right, I want you to just look at my finger and do not move your head, just follow it with your eyes, okay? So you're gonna go this way. Good job. All right, next we're going to be checking the pupils. I'll shine a light into each eye and see how they react. The pupils should be equal in size and reactivity to light. All right, can you remove your glasses for me? In this exam, I'm just making sure that the pupils constrict equally on both sides. This concludes the detailed eye exam. Always remember to document all findings accurately and report any abnormalities to your faculty supervisor. Thank you for watching this demonstration. Stay tuned for the next section on a detailed ear examination.
All right, next up we have the ear examination. If we don't have good ears for hearing, it's kind of hard to participate in sports, although it can happen. We really just want to take a gross assessment. We want to first look at the external ear, make sure they're symmetrical on both sides, that there's no swelling or abnormalities. The next part is we want to take our otoscope. We'll want to put a little speculum on. If you look here, this is a little speculum. They are disposable. We'll want to get a disposable speculum, put it on our otoscope so that we can use a new fresh one for every student athlete. These will be provided to you at the PPE event. So we'll put that on there and we'll look in each ear. What we're looking for is we're looking down the external auditory canal to make sure there's no swelling, redness, or discharge. Also that there's no foreign bodies. We're also looking for wax, which is a really common abnormal finding. And the second thing we're looking for is the tympanic membrane, which is the eardrum at the back of the external auditory canal or ear canal. We're looking at that to make sure we have a nice light reflex coming off of the eardrum, that it is not particularly red or bulgy, and that there's no signs of a fluid behind the tympanic membrane. Last but not least, if during our interaction with the student athlete, we notice that they're hard of hearing, we can do a hearing assessment if needed. Usually we start with the basic whisper assessment where we kind of test to see that their hearing is equal on both sides. But it's going to be kind of hard to assess for this because usually there's some level of background noise, being that we have a lot of student athletes and a lot of PA students circulating at the same time. So if you notice that there might be some hearing difficulties, please get your faculty involved. Now let's take a look at what an ear examination looks like.
Welcome back to the EENT station. In this demonstration, we will review how to perform a detailed ear examination on a student athlete, which is crucial for detecting any potential issues that may impact their sports participation. Let's start with the external inspection of the ears. I'll look for any deformities, lesions, or discharge. I'm observing the outer ear for any signs of trauma, redness, or swelling. Eric's ears look healthy with no visible abnormalities. Next, I'll use the otoscope to check the ear canal and tympanic membrane. Eric, please stay still while I look inside your ear, okay? I will also demonstrate how to hold the otoscope. So generally when I hold an otoscope, you can either hold it like this, or you can hold it like this. And you'll want to pull a little bit on the top of the ear, and then stick it in and look. I'm looking at the ear canal and the tympanic membrane on this side. And then I'll do the same thing here, pulling up and out a little bit, placing the speculum inside the ear, and observing the tympanic membrane and extra auditory canal. Good, that looks good. This concludes the detailed ear examination. Ensure you perform this thoroughly and document all findings accurately. Any abnormalities should be reported to your faculty supervisor. Thank you for watching this demonstration. Stay tuned for the next section on a detailed nose examination.
Next up, we have the nose exam. This is a really quick exam to take a look at the external nose for any deformities, lumps, bumps, and the internal part of the nose for any redness, swelling, polyps. You'll want to ask, again, the patient if they have any history of allergies or any issues with their sinuses. To examine the outside, you kind of want to just examine and palpate. To look on the inside, you'll want to use your otoscope. You can leave the same speculum you used for the ears and just kind of gently look in both sides of the nose. So let's go ahead and take a look at what that looks like.
Welcome back to the EENT station. In this demonstration, we will review how to perform a detailed nose exam on a student athlete, focusing on identifying any issues that may affect their health and sports performance. Let's start with an external inspection of the nose. We are looking for any deformities, asymmetry, or signs of trauma. Good. I'm checking for any visible abnormalities such as a deviated septum or swelling. Eric's nose appears to be symmetrical with no obvious deformity. Next, I'm going to use my otoscope to look inside of the nose at the internal structures. Eric, please tilt your head back slightly. I also like to brace my hand up here and pull the nares open. I don't stick my speculum all the way in, I just kind of observe, looking at the nasal turbinates and the mucosa, looking for any abnormalities. We're also looking for things like polyps or obstructions. The nasal mucosa should be pink and moist. If there's any swelling or discharge, it could indicate an infection or something like allergic rhinitis. Eric's nasal passages appear clear with no signs of obstruction or abnormality. This concludes the detailed nose exam. Ensure you perform this examination thoroughly and document all findings accurately. Any abnormalities should be reported to your faculty supervisor. Thanks for watching this demonstration and stay tuned for the next station on the detailed throat exam.
Next up, we have the throat and dental examination. So in this assessment, the T part of the EENT, we're going to look at the back of the throat. We're looking for any redness, swelling of the tonsils, any pus or exudate at the back of the throat. We're looking to make sure that the tonsils are equal on both sides and that they're not abnormally swollen. We're also looking to make sure that the uvula, little dangly thing in the back of the throat, is at midline. Dental evaluation, I think, is one of the most important here because sometimes this visit that you'll do for these student athletes is the only time they'll see a provider in the whole year. And so really important to take a look at their teeth, look for general well-looking gums and teeth. And if not, you need to document and educate the patient on this. You're looking for inflammation of the gum line, any cavities, etc. So let's go ahead and look at what this would look like.
Welcome back to the EENT station. In this demonstration, we'll review how to perform a detailed throat examination on a student athlete, focusing on identifying any issues that may affect their health and sports performance. All right, let's start by inspecting the throat. Eric, can you open your mouth wide and say ah? Stick your tongue out for me. Good. If I can't see all the way to the back of the throat, I'm going to use a tongue depressor, which will be provided for you on the day of the event. So I usually use that in my non-dominant hand and use my light source in my dominant hand. So again, open, stick your tongue out, say ah. Very good. Excellent. So what I'm looking for in the back is any evidence of infection or inflammation. The tonsils should be of normal size and color with no enlargement or redness or exudate. Okay, Eric's throat looks great with no signs of infection or swelling. Now let's check dental health. What we're looking for is any obvious dental issues like cavities or gum disease. Healthy gums should be pink and teeth should be free from decay or damage. All right, let's take a look. Just open up gently. Good. Good. All right, so I went ahead and looked at Eric's teeth and gums and they all look normal. This concludes the detailed throat examination. Ensure that you perform this exam thoroughly and document all findings accurately. Any abnormalities should be reported to your faculty advisor. Thank you for watching this demo and stay tuned for the next section of a detailed lymph node exam.
All right, and last but not least for this section, we have the lymph node examination. Now, we know that we have lymph nodes pretty much all over our body. So this is definitely not, a sports PPE is not the opportunity to examine every single lymph node we have in our whole body. It's just a quick assessment. Usually we stick to the head and neck area. So you'll want to inspect, ask the patient, do you have any lumps or bumps anywhere? Inspect the neck, inspect the back of the neck, and then palpate. So with this, we want to do mostly cervical lymph nodes and kind of head neck area. So you'll use a general circular motion with your fingertips, feeling for any lumps or bumps or swelling. We want to also compare right to left. So you should do it at the same time. You're also looking for changes in size, texture, mobility, or tenderness. So let's go ahead and look at that demonstration.
Welcome back to the EENT station. In this demo, we'll review how to perform a detailed lymph node examination on a student athlete, focusing on identifying any potential health issues. Let's start by palpating the lymph nodes. Eric, please sit up straight and just relax your shoulders, okay? So we're going to start by checking the cervical area. We're looking for any enlargement or tenderness, and we're making sure that they're symmetrical on both sides. So I usually like to start with the preauricular lymph nodes and the postauricular lymph nodes, feeling for any swelling. Also feeling in the occipital area for any enlargement of lymph nodes. Then I like to go with the anterior cervical chain and the posterior cervical chain. I'm kind of just moving my fingers in a gentle circular motion, feeling for any enlargement. Over here in the submandibular area, the submental area. And then here in the supraclavicular area. Can you shrug your shoulders for me? Okay. And with Eric, he actually has a little lymph node enlargement here behind his ear, but otherwise everything is normal. All right, so this concludes a detailed lymph node exam. Remember to be thorough and gentle during palpation and always report any abnormalities to your faculty supervisor. Thank you for watching this demo and stay tuned for the section on the complete Station 1 demonstration.
All right, so most of the exams that you will do during a sports PPE event are going to be normal, which is great for a new PA student because getting all of those normal exams in your brain will make it a lot easier to detect when we have abnormal exams. And this is a good opportunity to discuss some of the common abnormal findings and red flags that we need to be on the lookout for. So from the appearance section, we want to look for signs of malnutrition, dehydration, poor hygiene, abnormal vital signs like high blood pressure or irregular heart rates. And then the real bad red flags or things like that would be evidence of murmurs on their prior history, irregular or rapid heartbeats, signs of heart disease. So you'll want to note those, and if you need to, you might want to communicate with your team member in the heart and lung assessment to let them know to look out for this. As far as the eyes are concerned, there's a lot of things that we can have wrong with the eyes that we might encounter on a PPE event. Some of the more common ones that we'll see are strabismus, when the two eyes don't align. So we look one way and one eye looks and the other one stays, or lazy eye, sort of to speak. We can also see that one or both of the eyelids can be droopy. We can also notice pink eye, a red eye for any given reason. Vision issues are really common as well. A lot of us do wear either glasses or contacts, and a lot of the student athletes will. And sometimes it's just that they forgot their glasses. So you'll want to ask them, do you wear glasses or contacts? Did you test with them? And see if you can assess that. Some red flags would be if the pupils don't react evenly. That can be a sign of an optic nerve problem or even a brain problem. So we want to definitely pay attention to how those pupils are constricting on both sides. We also want to really follow their eyeballs when we do the extraocular movement testing to make sure that they are tracking normally and that there's no abnormalities with that. As far as the ear exam, some of the most common abnormalities we'll see are cerumen impaction. Cerumen impaction is a lot of wax gets kind of compacted and it gets pushed into the ear. And this can be a problem because it can be just cause some discomfort, and it can also cause some hearing loss. Another common finding we can see is what's called otosclerosis or eardrum scarring. This can look like little white patches on the eardrum itself and can be a sign of prior history of ear infections or even ear tubes. And there's a chance that in middle school or even high school, we might still have a student athlete with ear tubes that were placed. So just if we see that, we might want to talk to them and ask them, did you have tubes? Do you have any problems with your ears? Now, moving on to the nose, common abnormalities would be, an abnormal lump or bump from trauma or history of trauma, deviated septum, and nasal polyps. If we see any nasal obstructions, foreign bodies, or anything crazy like that, chronic sinus issues, tenderness to this area, we should let our faculty know. As far as the throat, common things are going to be big tonsils, maybe some redness or pharyngitis from a cold or infection, and dental caries or cavities. Red flags, signs of really bad infection. If you look in the back of the throat, it's really red. You see pus on the tonsils. You definitely gonna want to let your faculty know that. Also, if they have really, really poor dental health, we might want to speak with the parent about that. Last but not least, the lymph nodes. Common things are going to be just mild lymphadenopathy. Maybe they just had a cold or an ear infection. They might have some swelling on some of their lymph nodes. If you notice a really large lymph node that's abnormal or inconsistent with the other side, or it's exquisitely tender or red, we definitely need to let our faculty be aware of that. All right, so I think this is the perfect opportunity to see a start to finish demonstration of Station 1, and we'll go ahead and take a look at that now.
Welcome to Station 1, covering the general appearance, EENT, and lymph node assessment. In this demonstration, we will go through a complete Station 1 exam. Let's begin with reviewing the athlete's relevant medical history. Hi, Eric. I'm Christina. I'll be your physician assistant taking care of you today. First, we're going to take a look at your medical history. Now, do you have any medical problems?
No.
Have you been hospitalized in the past year?
No.
No? And let's take a look at this a little more. Your vital signs look nice and normal, which is great. Do you have any other problems with your eyes, ears, nose, throat that you know of?
My eyesight is a little weird.
True. You're wearing eyeglasses, and I see here that your visual acuity is normal with your glasses, which means you can see good with your glasses, which is great. Okay, so that being said, is it all right if I go ahead and proceed with your exam?
Yeah.
All right, great. So first we're going to start with the general appearance. I'm just kind of looking over everything here, making sure that everything looks nice and normal, which it does. Great. Next I'm going to look at your posture. You're sitting up nice and straight, which is great. I'm looking for any obvious skin stuff that I can see with my plain eyes, although we'll do a more detailed assessment of your skin later, okay? All right, next we're going to move on to your vision. I noticed that your visual acuity is great. Next we're going to check your eye movement. So I want you to just look at my finger here. Follow my finger with your eyes without moving your head, okay? Very good. All right, I'm just going to take a look at the outside part of your eye. Look up for me. Looks great. All right, take off your glasses for me. Look straight at my nose. Good. Good. Just making sure your eyes constrict. They look great. Moving on, we're going to go ahead and do the nose exam. I'm going to take a look at your nose externally. Everything looks normal there. Take a look inside your nose. Looks great. All right, moving on to your ears. Any trouble with your ears? No? You can hear okay? Great. Now look inside. Eardrum looks good. No wax. Same on this side. Great. All right, now let's take a look at your throat and your teeth. So I'm going to use a tongue depressor here. Open up. Okay, well, stick your tongue out for me. Say ah.
Ah.
Very good. All right, just take a look at your teeth. Excellent. All right, the last thing we're going to do is check out your lymph nodes, okay? So I'm just going to feel around here and make sure I don't feel any swelling. You have a little bit of swelling back here. Okay. Feeling back here in the front, up here, right here. Can you shrug your shoulders for me like that? Great. All right. So that concludes the exam, and everything looks good here. You can move on to the next station, okay?
All right, so let's look at the summary and key takeaways and recap the main points of this section. So one, we need to look at the overall appearance of the athlete. Really important to kind of take a step back and see what they look like at a glance. We will want to also review their vital signs at this point. We want to look at all of the components of the physical exam in Station 1, also including the EENT exam and the lymph node exam. And we want to brush up on our common abnormal findings because we want to be able to recognize them when we're doing these physical exams. And remember to report any abnormal findings to your PA faculty supervisor. All right, next up, we're going to have a post-test comprehension quiz to test your understanding of Station 1 components. And after that, we will let you know that up next is the Station 2, which is the heart, lung, abdomen, skin, and pulses exam. So in this station, we'll talk about the overview of the heart exam, the lung exam, abdomen, skin, and pulses. We'll also kind of prepare you for that and show you common abnormal findings regarding that. As always, if you have any questions, please feel free to reach out to us via email and we'll be happy to answer them for you. See you in the next section.